Elizabeth, let me just get your reaction first to Donald Trump knowing the threat to the American people from coronavirus and doing nothing. If anything, doing something worse than nothing, as Donna Edwards points out, going out and having his public statements really distort, misrepresent, and lie about the truth, about the intelligence he was in possession of. Does that ring true to you from bringing him other kinds of threats?
It's absolutely consistent with what I experienced in January. I was actually relieved when it was reported that he had the audio recording, so we could finally hear it directly instead of the spin that we usually hear from the White House. Multiple people were ringing the alarm bells in January saying we needed to lean in, we needed to activate the plans that we have had in place for 15 years, and to do so requires consistent communication to the public. I thought the White House's response this afternoon that he didn't want to cause panic, that this is what leadership is you're looking out for your people and making sure they don't panic. That is contradictory to what all of our plans when it comes to response, whether you're talking specifically about a pandemic or any type of other threat, a terrorist threat or a natural hazard. All of our plans call for clear, consistent communication in a timely manner through designated points of contact who are educated about whatever the threat is. And while you see at points in our government an attempt to do that, an attempt to have Dr. Fauci or Dr. Birx be that spokesperson, the president has just trampled all over their message and created so much confusion. But let's go back to the revelation today that he didn't want to panic people. The way that you don't panic people is you give them the facts. You speak clearly about what we don't. The medical community, the scientific community was telling us we needed to be doing at that time. And by doing that, it would have sent a very strong signal to all of the men and women in the government that are trying to do the right thing, that he had their back, to lean in and treat this with the urgency that it deserved. Instead, we saw the opposite effect. You saw public health officials and FEMA officials trying to figure out how do I actually do my job, because I think I need to lean in and be urgent and get the PPE and activate the Defense Production Act. They were talking about that in January. And instead, they're hearing from their president, no, it's no big deal. It's going to go away on its own. And that creates a chilling effect so that the senior-most leaders in the government were trying to navigate and figure out how do I actually tell my staff, yeah, lean in, but don't talk about it too much. Don't tell the American public we're doing anything, because it might get back to the president and he might get mad at me. That's what January and February were. Utter incompetence. And absolutely, I think he is responsible for the deaths of Americans. You had that Columbia University study that said even if we had done a shelter-in-place social distancing 1 week earlier, it would have saved 36,000 lives. And then if we had done it 2 weeks earlier, it would have prevented 84% of the deaths and 82% of the cases. I think there's an argument to make, and when we get to the other side of COVID and you do the lessons learned and you find out what actually happened, we probably should have been implementing measures in mid-February. And think what that would have done in terms of saving lives, but also helping our economy to recover faster, because we wouldn't have had as sharp of a public health concern, because we would have contained it early on. It's so devastating how incompetent he is, and he cannot continue to be our president. Too many lives have already been lost.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.